looking at the 2023 videos. So let's share the screen. Okay, so our first task is cherry angiomas. Cherry angiomas. Now, in this particular case, you're an FY2 in a GP surgery. A 50-year-old man has presented with a rash, or sometimes may present simply with concerns. What you must do is talk to the patient and address the concerns. So there's not much in the patient information. He has had some rashes for a long period of time. Okay, they are now spreading and becoming worse. He has had some rashes for a long period of time, mainly on the chest, in the abdomen, so on the trunk mostly, but it is now spreading to the hands. And the wife has asked him to go and see the doctor. So he's here actually because the wife has asked him to see the doctor because these rashes are increasing in numbers. He has got some questions. Why do I have these rashes? What do you think is a cause? Emotions-wise, normal emotions in this particular station. Approach to this particular task. One is grips. Then you're going to take the history of the skin lesions. Remember, we looked at the video of an approach to skin lesions. You're going to use the same approach in here. In particular, remember to ask about the durations. How many lesions the patient has? Is it only one or is it several? What's the color of these lesions? Are they increasing in size or are they increasing in numbers? This particular patient, they're increasing in numbers. They're also increasing in size. Are there any symptoms, any bleeding, any itching, any color change? Okay, you need to be asking for those as well. And remember, the differential diagnosis is malignant melanoma, spider nevi, congenital hemangiomas, Kaposi sarcoma, or cholangiomas themselves, which we're going to talk about in a second. Now, the typical features of cholangiomas include, they are usually 1 to 3 millimeters in size, usually on the trunk. Typically, they are bright cherry red color, and therefore they are called what? Cholangiomas. But otherwise, an angioma, meaning coming from what? From the blood vessels. In particular, it is from the capillaries. Okay, they may appear a little bit bluish in color, these cholangiomas. Okay, they are non-blanching, usually occur on the trunk and the upper extremities. So initially, for this particular patient, it was mainly on the chest and the abdomen, and now it has spread to the upper extremities. And usually, the cholangiomas are asymptomatic. The lesions are there, but they do not cause any symptoms. In particular, we're talking about bleeding, itching, pain. They do not cause those particular symptoms. You have to complete the other history. That's the PMAFTOSA, the ICE, the effects of symptoms, and you remember to summarize the main points in your history. That also helps you to actually narrow down your differential diagnosis. Now, when you ask for examination, you'll be given a photo. For example, this particular photo, and you can see here they are numerous, 1 to 3 millimeters in size. You see they are cherry red, and therefore the name cherry hemangiomas. Diagnosis after we looked at the lesions, explain to the patient he has got what we call cherry angiomas. Remember, it's not only one; it's several. These are benign skin lesions. They appear in the middle age or older, so 50 years and above usually. Okay, they are formed. Yeah, let me change this one. They are formed from dilated vessels. Yeah, it's supposed to be from dilated small vessels called the capillaries. Okay, it's a dilatation of the small vessels, in particular the capillaries. That's what formed the cherry angiomas. How do you manage? Well, reassure the patient. The lesions are usually require no treatment. Okay, treatment is rarely needed, especially if they are widespread. In this particular case, this particular patient has got lesions on the chest, on the abdomen, the whole trunk, and the upper extremities. Okay, so it would usually need no treatment in this case, only reassure them that it is not a cancer or anything serious, they are cholangiomas. Treatment usually needed. If treatment is needed, then we need the treatment required is usually sclerotherapy, electrocautery, okay, curettage. Okay, these are the treatments usually used. Explain that in his case, no treatment is required. Offer a leaflet about cholangiomas. Thank you.